Welcome to CMM Off the Page, a podcast brought to you by CMM Magazine, a brand of Care Choices Limited. Guest speakers will equip listeners with take-home advice to support best practice in the social care sector. The podcast is available to listen to on Spotify, Apple Podcasts, and to watch on the CMM website. We hope you enjoy this latest episode.
As the UK's #1 provider, Moneypenny is the leader in outsourced calls, live chat and more. We handle over 20 million customer conversations each year on behalf of thousands of businesses. Our 45-strong specialist healthcare team is dedicated to looking after calls and chats for the health and care sector, including leading care home networks and providers. We're delighted to be attending the Care Show on the 11th and 12th of October. Make sure you come and see us at stand E42.
We would like to advise our listeners that one of the guests in this episode, Adam Hunt, has now left his role as Digital Transformation Lead at the National Care Forum. The National Care Forum has welcomed Beverly Footet into the Digital Transformation Lead role. Please do read our summary of this episode for the latest resources relating to the National Care Forum's digital projects.
Hello and welcome everyone to CMM Off the Page. Today we're going to be delving into the world of technology and we'll be looking at the role that technology plays to support independence within care settings. And it's fantastic to be joined today by Professor Vic Rayner OBE, the Chief Executive of the National Care Forum, and alongside Adam Hunt, who is the Digital Transformation Lead at the NCF. And also Joanna Scammell is also with us today from Community Integrated Care, one of the largest charities within the social care sector. So it's fantastic that everyone is joining us today and look forward to our discussions. So Adam, you're incredibly passionate about new and innovative technology that really puts people at the heart of tech solutions. How would you say the sector has embraced technology?
Well, I think we're all very, very excited about the potential for technology, and we've definitely got some absolute forerunners and those pathfinders out there. And Joanna is going to be speaking more, so I'm not going to not steal her thunder there for this one. But I think there is that great appetite, and I mean we've got the things like the Digitising Social Care Fund delivered to through ICSs at the moment, where there are elements of unpicking what care technology can do, the benefits of it. And we were seeing providers that are very keen to get on board to help pilot, to help test. So I think it's fantastic. And I think the thing that really hits the nail on the head is the potential that technology can have for those real person-centered and almost tailorable solutions to tackling some of the challenges that people face. And that can come in a variety of different shapes, sizes, intensity of that tech as well, like how much is required, how little is required. So I think that's the real interesting thing. That's the real buzz it can create.
Fantastic, yeah. And also you mentioned about it enabling people to have that choice and control as well, which is obviously quite an important aspect. Exactly,
and that's what we all want to strive to achieve as providers. That's what we want. We want to offer that quality care. We want to offer that person-centered care. We want that person to have that control and choice within the care and support they receive. So that's what's brilliant about it. But it goes hand in hand with the quality support delivered anyway. So we've got those in-person, the quality of in-person carers and the support they provide is matched with that of technology. So it's not sort of essentially replacing in that respect for a lot of it. It's just working in harmony and kind of creating that real nice sort of blend.
Brilliant, yeah, fantastic. And Vic, there is, the government have shown quite a lot of enthusiasm for technology innovation. There is promised funding for the next 3 years. For providers, what do you think that funding really means in practice? Where do you think that could take us?
So the funding, I would say, probably characterize the funding that's available at the moment as less about innovation, more about implementation in a sense. So a lot of it is focused around something called the Digitising Social Care programme, as Adam's mentioned, and the bulk of that is about ensuring that up to 80% of providers by 2024 are utilising electronic care planning records. So that that's a really, really important step forward for the care sector. And I think, for people who are wanting to find out what's going on in their local area, we've got certainly on our website a very useful on the digital social care website, a very useful map, which will enable people to see what funding is available in their locality, and what the sort of priorities are under their within their local ICS. So a lot of that's focused around digital social care records. There's some funding that's available in relation to falls prevention, and some of that is focusing on sort of bits of tech like acoustic monitoring or sensor-based tech that enables people to in a way, perhaps more falls identification than falls prevention, but that's the terminologies around falls prevention. So, those are, again, are really useful kind of steps forward. I think in the innovation space, there is less direct funding available from government, but there are lots of other interested parties who are busy looking at this. So, for example, we're working in a project called TAPI, which has been funded in order to try and think about some of the off-the-shelf tech that people might use within their own homes, and then properly evaluate how that might be used. So things like, Alexa, Google Assistant, those type of bits of technology, how they might be used in the home. Sensors, for example, are incredibly cheap technology that people could use that might enable people to identify whether some of the common activities that people normally do within their morning routine, for example, can be picked up and identified and alerts set off, so that we're moving into perhaps more tech which enables people to kind of draw down care as and when they need it, rather than it be set in stone by a rostering system by somebody over there, or somebody who's commissioning it. So it's putting people more in control. I think the bits that you talked about, like AI and some of the robotics stuff, I think we're only just beginning to understand it. The challenge for social care is, unless we start to own that area pretty quickly, it's going to run away with us before. Well, or we'll find that we have kind of solutions imposed upon the sector that aren't really about what people want, are potentially about what's the cheaper option or what's the available option. Tech has to be, I think in the current situation we're in right now, there are probably two big drivers for the adoption of tech. One is about what people want and need, and I think very realistically the other has to be about what does that do in relation to the workforce. So Adam's mentioned about the tech particularly enabling people to have more control. I think what we also should be beginning to talk about properly is what tech can minimize some of the roles that staff have to play. So maybe in relation to robotic cleaning, to sort of sensor-based tech to identify people's sleep patterns, etc. So that means then the staff that are available can do some of the more face-to-face, human-centered kind of care. So we have to see it, I think, through both lenses. We're good at talking about what it does for people. We're less good about the reality of what does that mean in terms of the time for the workforce.
Yeah, no, absolutely. Absolutely. And Joanna, so community integrated care, you've actually been running a number of pilots, haven't you, around technology across the UK. What have you learned so far with doing that? And also just mentioning, what Vic's just said there about, that co-production as well, because I know community integrated care are quite keen of it's sort of the circle of support, getting involved with the support workers as well as the family members and the individual. That's just quite interesting. Your approach.
So actually picking up, it was really interesting hearing what Vic and Adam had to say, because actually I think the first point is really about independence, that choice and control, but actually promoting, looking at supporting people to promote their independence. So actually, how can technology enable somebody to perhaps not have someone sleeping in their home when actually they could still be safe and be comforted and be safe and be personalized. We've been working with a gentleman who had 2 very short physical calls per week, and he now has a call every single day, and takes his tablet. He's just been on his very first holiday where he took his tablet and called into the centre to find out where am I where am I in terms of how do I get back to my hotel, how can I get the next bus home. So really had that confidence to do something that he wouldn't have done before, because he knew he had the support and the backup. And I think that's really important, because it is about the technology. The technology is not the most sophisticated, piece of kit ever, but it's about how we linked and will continue to link a technology enabler to changing the way that care was delivered for that individual. And I think it's linking up those bits, as I think Adam and Vic both said, linking up the way we deliver care with the ability to provide independence, because one without the other, it isn't as meaningful and won't create as much change. I think Vic also touched on, if we do not keep up with the pace of change, if we do not use that, then someone will create something and impose it on us. And already in social care, I think we're seeing that. We're trying to find use cases to fit pieces of technology that have been developed, rather than looking at what people need and how that would best support them, and then going to procure that piece of technology. So I think that bit around staying ahead and constantly innovating and really looking, as I said, about how we use that to change the way we deliver care and support, but also how we change the way we work. And again, Vic touched on that. We've got a number of pilots. I referenced, Adam referenced one earlier, where we have centralised some on call for our workforce to try and we've taken that and made that a technology process as far as is possible, working with our teams, and that enables teams to more often, now kind of 99% of the time, have the weekends and evenings off. That's starting to make care more sustainable for them in their day-to-day life. So we want people to stay in the sector, we want them to enjoy what they do, and part of that is using technology to make our workforce more sustainable, enable them to have proper breaks so that we can retain them and they can enjoy that piece of work. It's also about, as Vic said, scheduling people to the right place at the right time, so being kind of a bit more disruptive in changing the way that we deliver social care, so it's less fixed and more enabled to support what people's wants and needs are. So yeah, we've had some pilots around workforce, as I said, around on call and around responding and responder models that you might hear in the market at the moment. So actually using devices and sensors to work differently to respond to somebody's need. We've also got pilots, as I said, around particular people's homes and putting different types of sensors in. We've got voice activated sensors, we've got video activated sensors, but again, it's very much around putting the sensors in and then changing the way that care is delivered with the team that are supporting that individual. We are just about to start a piece of work on machine learning. Now, I think we've got a bit of work to do between the difference between AI and machine learning. I think most of what we've got is probably machine learning, but in particular support for people with complex difficulties or increasing frailty, increasing comorbidities, to take a kind of a health word, if you like, in that social care environment, there's such a huge amount of intelligence that we can gather and use, and that will lead us to support people around early prevention, early identifying when somebody's condition, maybe exacerbating, or they might be at risk of going into crisis. And again, I think we have to keep ahead of that, as Vic said, because we can use some of that to support the prevention agenda, support early intervention. But at the moment, we've got such an awful amount of work to do as a sector in terms of getting everybody just on digital, that we need to be careful we're not going to miss the boat for the next stage. So I've got a fantastic job because I'm able to pilot some of these things and try them out. And so, that's something that's, a real privilege to do, really.
Fantastic. Yeah, thanks so much, Joanne. And you speak about getting people getting on board and the workforce getting on board. And I know Vic, I know the NCF being working with Schools for Care on the digital leadership program, and that sort of having the providers having the confidence, to implement that. And I was just wondering if you could share a little about that in terms of how you support providers in rolling out new technologies.
Yeah, well, I'll let Adam talk a bit about the digital leadership program, because he's focusing on that. But I think this point about how do we stay ahead of the curve is hugely important. I went with a couple of colleagues from Digital Social Care to a conference in the States last autumn, where we were seeing, much greater use of robotics, for example, everyday use of robotics. And one of the reasons that was possible was because the market had been seen to be sufficiently large that there was a kind of, there was a lease-based model to it, so people could rent a robot. You know, it's a
Wow,
different
rent a
sort of
robot.
thinking. But then to my great excitement, we had at our managers conference, we had an organization, a fantastic charitable organization called Robotics for Good, who are based out of the University of Nottingham with their robotics centre there. And actually, anybody listening to this can contact Robotics for Good, and you can lease a telepresence robot for a very reasonable amount over a period of 3 months to try it out. And I think that's what we've got to get people to do. That's what we've got to get organisations to do. You know, I think, I mean, to Joanna's point, that the use case, you know, we've got bits of things and we're trying to work a use case around it, probably, but you know, so be it in a sense, because I think a lot of this tech has fundamental uses for most people in society. I think what we might need to do is be really clear to those producers that actually, you know, that those suppliers in the future need to think of this market first, perhaps, rather than you know, I've said this a million times, so apologies if I'm boring people to say it again, but I always drives me completely crazy when I see the Apple Watch advert, or you know, a fitness app advert, where where somebody falls and they're in the middle of the woods on their own in the middle of nowhere.
Oh yeah,
running.
I know the one.
Like,
yeah,
you know, well, actually, most people fall at home on their own, and wouldn't it be much more useful to be saying this is something that actually you can you know, you can buy your relative or whoever it might, you can buy for yourself, and then somebody will know if you've fallen. That's a bigger audience than
exactly.
the number of people who want to go out running completely on their own and nobody knows that they're where they are and, you know, what they're doing. So how can we get those sets of markets, so we're not trying to fit around the kind of tech, we're shaping the tech going forward. But yes, and I think actually just to link to the digital leadership, part of what we hope to do with the digital leadership program is to give managers and organizations the confidence to be clear what they want from tech in the future, and that's a message we've got to get out to the sort of the people who are busy building all this stuff for 10-15 years hence.
No, absolutely, Vic, definitely. And Joanna, did you have something to add on Vic's point there?
Actually, I had a question for Vic based on what you just said. I think it was really interesting what you said around, you know, the market, and actually trying to prove to people that there is a market. And one of the things I'll admit that surprised me from moving more from health into social care has been the lack of structured data. And actually, do you think that as a sector that we're doing enough to put sort of some structure into our data and records and coding so that we're able to demonstrate that there is a big market for people, or is that still very much a work in progress? Because it's fantastic having so much person-centered care, but without an ability to match kind of codes to data, we're limiting ourselves by showing that actually, you know, the trends, the patterns, the benchmarks, the ability to integrate with some of those larger systems and the big data lakes. Are we kind of victims of ourselves by not making more of that?
So yeah, I mean, quite possibly, in the sense that, and I kind of think that almost, you know, people listening might be going, what? And I think that's part of the challenge that we have. No, well, I'm kind of thinking, what? Well, that's part of the challenge that we might have. But there is a really interesting piece of work that's going on, which is in relation to terminology. So looking at SNOMED coding, you know, the most well-recognized kind of international kind of coding system, and thinking about how social care planning particularly can be mapped onto SNOMED. And that doesn't mean that suddenly everybody needs to know, you know, SNOMED coding in social care. It should be completely back, you know, behind the scenes, and nobody needs to know. But of course, what that then means is that suddenly there will, I imagine, be a great additional pool of data coming into that data lake, which would show how much social care. I mean, you know, for me, the great leap forward in terms of getting care planning on electronic record systems is that, you know, you've got hundreds of pieces of data potentially on an individual per day, and currently still, sadly, for too many organizations, it's locked away in a filing cabinet and never gets to see the light of day. So by having that in there, but yes, you're right, we then can't sit in glorious isolation and imagine that people people who use care services don't use any other types of services and aren't part of that. So yeah, we've got to get better, but the SNOMED program, I think, will help with that, along with, I think, a greater use by organizations like yourselves and others to sort of be saying, we're pushing these boundaries, but we've got to make it better. I mean, there's been some interesting developments like the assured supplier listing, which I think for those organizations who are part of that, they're beginning to see that, being on that type of listing means that bodies like integrated care systems are suddenly looking at them and understanding that they are players in a market, and that, so there's a sort of a kind of snowballing of all of this, that again we've got to keep ahead of, but recognize that all these are sort of small layers of snow that will eventually make us recognize for the large market that we are.
Yeah, fantastic, Vic. And you mentioned there about a little bit of reluctance maybe from some providers to implement and technology. Adam, I wondered if you would come in just in terms of some of those barriers, and providers listening here. What reassurance can you offer in terms of what are some of the broader barriers of implementation of new technology, and how can you
So there are quite a few, and it's never really the elephant in the room because it's quite obvious, but I think having time and being able to focus on what is out there and know where to start and unpick. I think we've come on quite far along the journey at the moment with a lot of technology on offer that, if you're coming in quite new and taking the plunge for the first time, then it can feel very daunting. I think this is something to a couple of years back now, I think I can say, the digital technology and skills review was published, Skills for Care and NHS X, now NHS Transformation Directorate. Fantastic piece of work, and that identified a lot of those barriers to where technology wasn't being adopted, and that can come down to the digital skills of the staff team, for instance, and how you kind of tackle that, and how you bring your team along with you. So if you are a leader that has identified technology, how can you then also bring your team along with you? So that can be a humongous barrier. So if you have managed to get your head into what technology is available out there, what funding is available out there for technology, then you've got that added task of bringing your team along with you. And I think we've got a few. So one thing we picked up, that I can share a bit more about is the digital leadership program. But I'll also put another note before I go into the digital leadership program about the support you can get from digital social care as well, and how that can offer, that guidance. That can offer there's a fantastic thing, that things like a glossary listed on there that you can go through and look at. What is acoustic monitoring when people are talking about it, and actually, you can use that to inform yourself, or use some really handy templates and guides to support your journey. And that's a fantastic first port of call as well for those out there that are thinking about where they essentially start to get digital, really. But I think for the digital leadership program, I think that is structured around how we develop existing leaders, predominantly registered managers, how they can be developed with the skills to be able to lead digitalization in their organization for their home, how they can essentially bring that technology across the threshold and start using it. And that's another area which was picked up in that digital skills review, is around actually getting your hands on technology. And we're talking about pilots, and we're talking about the leasing of robotics, and it will be digital leaders that can get this through that front door, that can get those staff teams on board, because their role will be around building that culture of technology as well. Even if it's not there now, what have we got coming up? We want to move from paper records. What have I got to do to get my team thinking about that, about thinking that is the future, a very, very near future, hopefully, if we're going across to that. So it can be a lot around that culture building. But I think for key for those digital leaders around being able to identify not only the benefits of technology, as Joanna has already mentioned there, but also be able to unpick what the risks could be, how you can bring co-production into identifying what that technology looks like. So it really should be something that's done with people in receipt of your care and support, as well as your staff team as well. And we're talking about who it's going to benefit. And Vic was saying about where technology could replace people. We need to be able to have kind of open conversations about what the payoff is, essentially, when we're talking about technology, and how it is going to change how we deliver support. But being able to have those conversations, how to build that into the design of what the solution will look like by working with people in receipt of care and support and staff teams as well, is the way to kind of mitigate any risks to it being kind of poorly planned. Being able to monitor that technology as well is a really key skill. And again, Joanne said about through piloting what you can do through your learning, and and how you can put that into action. I think these are all really, really key and core strong skills that a digital leader will need. But Joanne, I can see you got your hand up. I'll let you jump in. Otherwise,
I was always just going to add to what you were saying, Adam, and sort of back that up from a provider perspective, which says I've been really impressed by the amount of work that's already been done that's there to support people in the sector. So if you haven't yet digitized and you are a provider out there thinking of, what shall I do? I'm not a technology specialist. Well, actually, all that work has been done for you on the approved providers list. And actually, if you want to know who's using it, you can also find that out through the digital skills, I think, website, and certainly lots of providers are very collaborative. We're happy to have conversations with anyone to think about using the same software as us. I know other charities are the same. So I would say my advice would be to use the work that's already been done for you, and remember that you don't have to be a digital expert. Actually, the success of these and the benefits, all the tech bits kind of been done, and the providers will help you to implement them. The hard work and the bit that's there to really realize the benefits is that operationalizing of it. So it's the operational leads, it's putting it into action. So I think don't be put off by needing to be an IT expert. I don't think you have to be, and I think that's part of what your leadership role, Adam, is explaining. And I think as a provider, I would just really agree with what you're saying, that there's a lot of resource out there, and actually it's nothing to be afraid of, even if it feels like a really big leap. Use all the work that's been done for you already.
Exactly. And I think as well that we're concerned about the building of that culture. I mean, that's about having those conversations internally. That's about getting excited about it. That's about, somebody seeing, as we said, if I saw an advert for an Apple Watch for the first time, we're not being sponsored by Apple here, so
Definitely not.
But seeing that, but bringing that into the workplace, have that discussion with others. You end up getting those like-minded individuals. Wouldn't it be great if Jeff could get online, so he could do this because we've had this conversation recently? And that's where the essentially that snowball starts building, where you start bringing the good use of technology, best practice of technology in with you. I think, and that can be the difficult part. As I say, about bringing it across the threshold, it's not always about that physical bringing it across. Actually, it can be about those conversations, about getting that started first of all, and that is the first step. But definitely, a lot of the work has been done, by those that have been within the roles, as digital leaders. So it is about making use of that. It's about finding what has been shared, what stories have been shared. Podcasts such as this one, so really small. Sorry, Vic.
I'm just going to mention another project called Hubble, which was probably 2 or 3 years.
Beat me to it.
Yeah. So, but what I think that does is very neatly do what Joanna said, is that it talks about tech without talking about tech in a way. So it talks about all the things that you need to do in an organization, which is about supporting people, recognizing that people will have different levels of experience and confidence, that things will go wrong, that you need to kind of lead from lead with passion and lead from the front in a sense. There's lots of stuff around that. There's a great program called Digital Champions as well, which is recognizing that it's not just the leader. You need other people in the organization who probably would be fantastically valuable, and that doesn't have to be just staff. That could be people who are using care and support services as well, who are those champions. That you'll find like-minded people in different partner organizations. You might be finding people who are within the ICS or the local authority who are really interested in scoping out what some of this might look like in practice. I think it's, and the other bit of learning that seemed to come through from lots of members is, once you've done one piece of technology, do it well, really spend your time doing it well, but actually then lots of other things can flow from that, because you've given people maybe the parameters within which they can try things out. You've made it really clear that things can fail fast as well as take hold. And so you've kind of had some of those discussions, and then I think people will say, well, what about this, or could we try that? Or you mentioned risks. I just wanted to mention here another sort of source of support for people, which is something called the Better Security, Better Care program, because I think we're all alert to the fact that we are living in an environment where technology, digital is the sort of new place where people are looking to kind of commit crimes, to hack people, to carry out ransomware, and all of that sort of stuff is going on. So there's a great program called Better Security, Better Care, which has masses and masses of resources, but also very interestingly for social care has the fantastic potential of a sort of local infrastructure. So around the country you will find there are 29 what are called local support organisations, and they each have resources, funding and capacity to help you think through both your information governance side of things and your cyber. And actually going through that process, I think, unlocks quite a lot of the debates that you need to have. Now, it shouldn't shut down, it should be opening up, but you need to think about those areas as well, so that clearly, just in the same way that you envisage safeguarding in relation to the delivery of personal care, you're also thinking about the technology in the context of how do you ensure people are the best protected in that context too.
Yeah, absolutely. Thanks, Vic. That's really useful. Really good to have those signpostings. And Joanna, you mentioned that lovely case study of the gentleman looking for his holiday earlier. I just wondered if there was any other examples like that, but also just to show the impact really for providers listening on if they were to implement something and what's actually been the impact of that.
Yeah, so I think if I talk firstly records about digital social care records, I think the power in that is absolutely huge from being a local provider. I think in particular one of the challenges that we see at the moment is around consistent workforce as well, and I think that by harnessing digital social care records we are able to kind of induct people that might not be as familiar working when we need things like people like agency workers. We're able to introduce them to people that we support, to ensure that they've read the one pager about me before you're going to go in and support somebody who's receiving care. And I think that those parts are really important in rather than sifting through paperwork and sending somebody in to deliver care when you're perhaps not as familiar with that care or the care setting as you would have been. So I think there is a part around keeping people safe, us as leaders having the assurance of having the workforce that might not be so regular when you've got people like agency workers in, and making sure that care is personalised in that regard. So I think those are kind of the nuts and bolts from the digital social care record. In terms of the technology enabled care, yes, I've given you one example, and I could kind of give you many more really. I think there are a couple of examples where we have sent people who are going into an acute setting, so they've needed to kind of step up, step down, and they've taken all the technology with them, so they're still able to call home or contact their loved ones. So we have somebody who is support with complex needs who had a cancer diagnosis, and that person took their a tablet device with them into hospital and still called the virtual care centre, their normal care team, and their loved one. They were able to do that. Now previously this person would have needed one-to-one support in an acute setting, and now doesn't need one-to-one support because they're so kind of assured that they've got their normal access to their normal care team. If they're worried, they know how to contact them themselves and they can ask, and that's a hugely empowering piece of information ability for that individual, much better for their well-being, but also better for our system because we're not having to put in one-to-one support by someone they don't know. So there's an example there. We've had a couple of people who've done a similar thing to mental health step up, step down as well, and again just that assurance and continuity with their care team being able to reach out to people when sometimes an unfamiliar care setting wouldn't have been. So a lot of it is around that consistency of care teams and being able to identify early when, as you said, somebody may be going into crisis. We've had a couple of people that we physically supported who are now digital digital only. Now that doesn't mean that it's just they live in a world of sensors. It means they might receive, as I said, a daily call. We've developed an app whereby somebody can tell us how they're feeling, and depending on their response, then you could get a certain trigger. So if you say that you're feeling really happy and you're at a 5 and you suddenly go to a 2, we can set off an alert to trigger and call you within 30 minutes. But if you go from 5 to a 4, we might call you that very day. So we're constantly developing things like apps to go onto people's devices and tablets, whereby whatever happens, whatever their response is, we can trigger a personalized response to that individual based on their feedback. So there's a number of different ways you can do that, and I've just given one example, but that really, again, makes sure that that person gets the support when they need it, when they're telling us they need it, as Vic said, or when we're using, you know, some type of machine learning, which we're just piloting now, to kind of understand, is somebody moving less? Are they moving around the house less? Do we need to then be proactive and put in a call to that individual, right down to kind of personalized content and things? So the possibilities are endless. Most of the best ideas come from colleagues delivering care, not us, certainly not me. They are people on the ground delivering care, and they're saying, oh, how about this for this person? But particularly people with complex needs, mental health, learning difficulties, they are all personalised to those individuals, which I think is key. And none of them work in a standalone. They're all pieces of technology that then provide a response to somebody who's then going to go and do something about that. They're not into, you know, a huge call centre, they're into our virtual care teams. And there's no reason that any other charity couldn't also blend a model like that. It doesn't have to be that you're calling a separate telephony provider. So I've probably given far too much information there.
No, that's all really interesting. I was
talking about examples.
I was also thinking around, like, I know there's quite a lot around sleep monitoring as well, and there's speaking to a company, and I was quite interested in, yeah, I suppose the human side of that, and sort of monitoring someone's sleep by a piece of technology. And then
so there's some really good benefits to that as well. So some people are woken up to check for continence, but by putting in continence monitors, somebody can get a full night's sleep potentially, rather than having someone be disturbing them every hour, which is so
doing checks and
exactly, or
shining a light and everything else.
Yeah, absolutely. We've got an example whereby there's, you know, 4 independent living areas in one building. They all have a sleep in, and so actually, if we put technology in people's rooms that's appropriate, so sensor motion, voice activation, pressure sensors, smart plugs, any type of those, voice activated, video recording, they can call one responder who's in that building rather than 4 people who sleep in, or one responder between 2 or 3 houses. So again, maximizing independence, but not completely taking away people's ability to access support when they need it. So yeah, they're really popular. We really need to think. We're doing a lot of work around kind of sleep and where sleeps are really required, and we really do make sure that people are safe before we transition anybody over, but a lot of learning around that.
Fantastic, yeah. And Vic, do you have something to add to Joanna?
Well, I was just really struck by what Joanna was saying, and I know this is a big issue for organisations often, is about that communication, not just with the person, but with their family and perhaps other professionals as well. And I think, so there's 2 sort of sides to that. One is absolutely to this point about kind of safety. So, you know, are you doing, often people will run dual systems, for example, for a period of time, or they will, you know, put in additional checks that then can be sort of stepped down over a period of time, but explaining what that is and why you're doing that, and, you know, what are the things that you're putting in place, I think is one kind of area of it. And the other is that if we start to imagine that we can just stick a bit of tech in where we had a person before, we'll fail, you know, we'll really fail. So actually a lot of what Joanna's describing, and I think a lot of, you know, particularly back to my favorite robots, you know, what you need to be thinking about is kind of process, you know, described as process re-engineering. So we need to start to think about how might we do things really very differently with a different set of resources. And I think we, you know, we quite individual providers are incredibly imaginative. Systems are incredibly unimaginative generally. It's a big sort of sweeping statement, but, you know, where you have, for example, home care commissioned on a 15 minute basis or a per minute basis. This isn't the kind of environment that enables you to think really creatively. We've often talked about outcomes-based commissioning. Actually, I think technology really presents us with the opportunity to make that a reality, because not only can we be flexible about how we achieve the outcome, but we can actually measure that it's been achieved in a really evidence-based way, and I think that's that's where we kind of need to think about putting some of that energy, because that will transform. So if it enables Joanna and her colleagues to deliver care in 10 different ways to people who essentially have been determined to have the same need, then that's really exciting. Really exciting. But it's the outcome, and it enables us to say we've got a measure of that, and I can show you that. And that, I was just thinking back on the conversation we were having about data. You're right, we need to sort of show the market that what care can achieve, but we also need to show ourselves, because actually what data does is enable you to see the difference that you've made to people's lives in a kind of in a linear, in a way that you can see progress, where previously I talked to loads and loads of providers who've got fantastic schemes to support people with dementia or whatever it might be, and you say, well, how do you know this is working? They just say, well, I know the people that I work with, and that's absolutely true. But actually the data, the ability of tech and data is, it means we can say, yes, it really does work, and it would really work potentially for other people too, and this is how we can evidence it. So
yeah, no, absolutely. And you speak about the collaboration, Vic, and us almost we need to talk about it more and talk about the positive developments. And I think it would be difficult not to mention the Care Innovation Challenge. And I think that's something really quite positive that probably the sector needs to be aware of, because there is so much innovation obviously in the sector, and obviously Teamchip, obviously last year's winners. But I wondered, Vic, if you wanted to just share about that innovation that's actually going on that which people might not be aware of.
yes, of course. So the Care Innovation Hub is something that the NCF has taken over, or had gifted to us from colleagues who'd started it a number of years ago. And what that challenge is intended to do is to bring people together, a wide variety of groups of people, and give them an opportunity to think about what needs to change within the care sector. So they might be managers, they might be people who use care and support services, they might be university students, people who've had nothing to do with social care before, and they'll hear about what the kind of core challenges are, and they'll have an opportunity to spend a weekend with us, with a load of mentors, a load of supporters, and get themselves into a place where they come up with some great ideas for innovation in the sector. It's such a fantastic weekend. So anyone who's listening, go and have a look at the Care Innovation Challenge website, and think about coming to join us. It's fantastic.
Yeah, absolutely. And obviously CMM magazine interviewed the finalists from last year's event, so do visit the CMM website to read the features related to the challenge. Joanna, we are kind of nearing the end of our podcast today, but I wonder if you could do a sort of 30-second sum up for providers listening on just, if they were, to go away now, what would be your advice, having, experienced what you've done, what you've implemented, and sort of lessons learned really that providers need to sort of reassure providers, but also just to give them that take-home advice?
Yeah, I think we've touched on a lot of them today. I think it's, don't reinvent the wheel. Look at what resources are out there, in the sense of supporting digitizing social care records, but don't avoid doing it. There are huge benefits for people we support and your businesses as well, and there are really good resources to tap into. You do not have to be an absolute expert in every area in order to get those benefits from digitizing, but also don't be afraid to try different things as well. So I realize that's contradictory, so I'm saying don't reinvent the wheel, but that's for digital social care records. Get that record in place, and then use the experiences, your colleagues, your workforce, and the other resources that are out there to get involved in some of the innovation that Vic's been talking about today. And I've learned some few new resources that I'm going to go and have a look at, and the challenge that sounds incredible. So link in with those. Find out what innovative things are going on in your area. Don't be afraid to ask other charities. And then when it comes to technology enabled care, don't be afraid to give it a go. Talk to your commissioners. We haven't talked about that today, but I've found local authorities incredibly open to working with alongside the integrated care systems. They are waiting to hear from us about these innovative ideas. So don't assume that because not all the structures and levers work in the right way, that you can't give it a go. So absolutely give it a go. Get that digital social care record in place. Do that first and go from there, because I think there's some really fantastic opportunities that aren't limited, and there's a great kind of collaborative approach to doing that.
Brilliant. Thanks so much, Joanna. Yeah, and thanks so much for sharing so many great examples as well today. Packed a lot in, so I appreciate it. Oh no, it's brilliant. It's fantastic. And Adam and Vic, obviously providers might be wanting some events and webinars and things like that, but I just thought, if they're looking at sort of on that sort of professional development and sort of continued learning, I just wondered if you had any to signpost. Obviously we've mentioned quite a few, but if there was any key events coming up that you think they should be getting involved with.
Yes, well, first port of call, I would say, would be digital social care website. We host events through their masterclass series through there, which is really good. Some of the bits that Vic had mentioned around the Better Security, Better Care program as well, and strengthening your IG and your cyber and data protection. There are introductory sessions on there, so demystify it a bit, understand what's involved, and get on board, so you can address some of those key worries, as well as things such as our like the masterclass series, where we've tackled bits around bringing your team along with you in the past, and you can rewatch a lot of these through the website, and adopting a digital social care record system. So there are those resources there too, which are fantastic to tap into. But Care Innovation Challenge, definitely one to watch out for.
All I was just going to say is to remind people that we're not the only people in the world worried about tech and care. So there are some amazing innovations in other parts of the world. Our colleagues in Scotland have been doing some great stuff around a new role called a care technologist role, which is being trialled in a number of areas of Scotland, which is very much about enabling people who are living at home to be able to utilize a whole bunch of tech, but have that technologist who can come and sort out, what to do if some bit of it goes wrong. So to sustain that independence in that way. And I think that's going to be a great a role, but it's also something, we need to think about recruiting to that kind of role and data analysis type roles. But look internationally, we work a lot with an organization called Leading Age in the States, who have a great technology program that's been running for the last 10-15 years called CAST. So if you look that up, there's myriad of resources on there that take you through decision making and all sorts of stuff like that. The Scandinavian countries have been using acoustic monitoring, for example, for about 25 years. We're only just starting that journey now. So look to some of the evidence base in those kind of areas. And I think, the country that often gets talked about in the context of aging particularly is Japan. If you look at Japan, other Asian countries, Japan and Singapore, around use of robotics, machine-based learning, all sorts of stuff like that. They're feels a bit like light years ahead. Let's hope it isn't light years ahead, but it's definitely gives you a picture of some of the art of the possible, and that's what we need to get people interested in, excited about, and comfortable with a conversation. And the message that you've really helpfully picked out throughout this is about people need to be part of those discussions too. That the nothing about us without us mantra absolutely has to apply in the context of technology, and we need to get smarter and better and more effective at making sure people's voices are there, whether that's workforce or people using care and support.
Yeah, no, I think you made a good point as well, Vic, when you said you're not producing the tech to try and solve a problem. You know, it's a much bigger picture, and obviously, you know, working with everyone in co-production is obviously key to that. Fantastic. Yeah, I think we've covered an awful lot there. Certainly everyone's got a lot of reading to do, I think, with all of our resources and everything. Yeah, but it's brilliant to have everyone join us today. It's Professor Vic Rayner, OBE, Chief Executive of the National Care Forum, Joanna Scammell, who's Managing Director at Community Integrated Care, specialising in technology-enabled care, and also Adam Hunt, who's the Digital Transformation Lead at the National Care Forum. Brilliant. Thank you, everyone.
Thank you.
Thank you for tuning in to CMM Off the Page. Explore CMM's portfolio of content, including daily news, blogs, a magazine, and CMM Insight webinars by visiting www.caremanagementmatters.co.uk. To make sure you don't miss a podcast, follow CMM on Twitter @CMM_magazine and use the hashtag CMM Off the Page to join the conversation and share your feedback. See you next time. CMM Off the Page. Listen, learn, lead.